Aspirin, known chemically as acetyl salicylic acid, has a rich history that spans over 3,500 years. Its roots can be traced back to ancient civilizations, where willow bark was utilized for its pain-relieving and fever-reducing properties. The first documented use of salicylates, the active compounds found in willow, was noted by Reverend Edward Stone in 1763 when he described their antipyretic effects. The modern era of aspirin began in 1897 when Felix Hoffmann, a chemist at Bayer, synthesized acetyl salicylic acid. This marked a significant advancement in pharmacology, leading to widespread use as a non-steroidal anti-inflammatory drug, or NSAID. Aspirin works by irreversibly inhibiting cyclooxygenase, or COX, enzymes. These enzymes play a crucial role in the synthesis of prostaglandins and thromboxane A2, which are key mediators in inflammation and platelet aggregation. The chemical formula of aspirin is C9H804, with a molecular weight of 180.16 grams per mole. It is typically presented as colorless to white crystalline powder or tablets. Low-dose aspirin benefits and considerations. Low-dose aspirin therapy, commonly 75 to 100 milligrams daily, is primarily used to reduce the risk of cardiovascular events such as heart attacks and strokes, particularly in individuals with a high risk of these conditions. The mechanism behind this benefit lies in its ability to inhibit platelet aggregation, thereby preventing blood clots from forming. However, while low-dose aspirin can be beneficial for those with established cardiovascular disease or significant risk factors, its use for primary prevention in individuals without prior heart disease remains controversial. Recent studies suggest that the risks associated with low-dose aspirin, such as gastrointestinal bleeding and other serious bleeding events, may outweigh the benefits for many individuals without existing cardiovascular issues. Key considerations include: efficacy. Evidence shows that low doses are effective for preventing arterial thrombosis without significantly increasing adverse effects compared to higher doses. Risks. The potential for gastrointestinal irritation and bleeding increases with aspirin use, necessitating careful patient selection. Guidelines. Current recommendations suggest that low-dose aspirin should only be prescribed after evaluating an individual's specific risk factors for cardiovascular disease and bleeding. In conclusion, while low-dose aspirin can play a crucial role in secondary prevention of cardiovascular events, its routine use for primary prevention should be approached with caution and personalized assessment.